Thank you, Dr. Halfdonerson, Dr. Hope, and Dr. Nutting for those fascinating presentations. In this third section, we will discuss symptom management and complementary medicine. While we focus quite a bit of attention on treating the disease, quality of life is important, and that means managing symptoms so we feel good and can get back to the things we enjoy. So I'm curious to hear from each of you. What would you say to a NET patient about managing their symptoms? Dr. Hendifar, let's start with you.
Thank you, Lisa. I definitely agree that managing symptoms are super important. My recommendation would be, as the symptoms, if your symptoms are getting worse, you might need to make your treatment team a little bit bigger and get some more expertise involved, whether it could be GI symptoms or pain symptoms. There are practitioners who specialize in those fields that could sometimes really help. And sometimes you want to even expand your team to alternative practitioners. And in general, that's really recommended. Although I would say the caveat is make sure that if you're taking any supplements or any other medications or therapies, that you would seek out the approval of your primary oncologist or physician.
My advice is really, again, stay in tune. We know that many symptoms are very individualized. So be in tune about your body and how you're feeling. And I think it's really important to write down all of your symptoms and essentially keep notes on your symptoms so that you can really share the details of these symptoms with your care providers so that they can get a good handle in terms of what's the best way to address those symptoms.
I would say that I've found getting involved in your local support group or even a national support group and speaking and networking with other patients is truly one of the most beneficial and comforting things you can do as a patient. As you connect with other patients, you feel like you're not alone and you can get invaluable information from other patients dealing with the same symptoms, and they can give you suggestions that you may not have even considered prior.
Similar to my co-moderators, symptoms and side effects are unique to each one of us. Even though we are all zebras, our stripes are uniquely our own. So it's important to follow up with your doctor and let them know what is happening, and know that no symptom or side effect, no stripe that you're experiencing is too big or too small to go unmentioned.
Thank you, all four of you. What wise words of wisdom. So now we're excited to introduce our next set of speakers. I'll hand it off to you, Beth.
I'm very excited to introduce our next speaker. She is an amazing woman, a dear friend, and a fellow NetConnect mentor. Val has been living with carcinoid syndrome, but Val has also been an example of one who thrives with this disease. And through her story, I hope that you're all inspired as much as I am.
I'm very pleased to introduce Dr. Del Riviero, who is an endocrinologist and oncologist from the National Institutes of Health. Title of the talk is Symptom Management.
And I am honored to introduce Dr. Narjus Duma, who is a thoracic medical oncologist from Dana-Farber Cancer Institute in Boston. And she has been an amazing mentor to many junior physicians around the United States, and has been certainly a patient advocate as well for patients. And the title of her talk is going to be focusing on complementary medicine.
Thank you. And for our Spanish-speaking audience, both Dr. Del Riviero and Dr. Duma's presentation are also available to view in Spanish on our website. Again, that's www.lacnets.org/Spanish resources. Thank you to our silver sponsors, Novartis and Tercera.